Welcome to CTV News Trendline with Michael Stittle and Nick Nanos.
I was wondering, Nick, if you could speak more to the demographics playing into this and the average age of Canadians now.
Well, Michael and Avis, the intersection of demographics and the human resource crisis in our health sector is going to be a massive car crash. Period. Full stop. You know, check out, here's a trend line of the median age of the population back from the 1970s to now, and you can see that we're just getting older. Now, if you notice in the last year, it's actually flattened a little bit. It's because of all the new Canadians that have arrived in Canada. You know, if we bring in 500,000 new Canadians, that might flatten the curve a little bit. But the reality is that we're gonna be hitting as soon as the baby boomers get a little older. We're gonna hit a wall, and it's going to be a massive crisis where the demographic bubble hits what I'll say the HR crisis that we're having in the healthcare system, and it's going to be ugly. And to Avis's point, I don't understand how anyone can't see the trend line on demographics and can't see what's happening in terms of HR retention and put those two things together and say, we have to deal with both of these issues. The fact that our population is aging, but also at the same time that we need to make sure that we retain and have the healthcare workers, the frontline healthcare workers that are necessary. But it's I don't know what it is. It's like denial. Mm-hmm. I don't know, Avis, what we want to call it, denial kind of.
I think it doesn't serve their purposes because it's a short 3 to 4 year window. And if they fix the system in a good way and they lose the election, then the next government gets credit.
Yeah.
I don't know. And I think I've just become skeptical. And I noticed that when I put out a little note to ask people about what's going on, the immense amount of skepticism among Canadians that the current system will work ever is very low, very high for skepticism. They just don't believe there's really an incentive to long-term planning. There's no visionaries to say, okay, let's chart the right course. There's a lot of talk.
Avis, you remember what I remember, and you talked about the story of your parents and getting their OHIP card. There was a time, it might sound like that was a unicorn. There was a time when people were proud of the healthcare system, proud of what Canada had done in terms of a public healthcare system. And it was something that we talked about when we'd visit our friends and relatives in the United States and in other countries and stuff like that. We're not there anymore because, you know what, to your point, if anybody's talking about the healthcare system, it's about going to the emergency room where your child might have a sprained arm or a broken leg and it's not life-threatening and they're waiting. Or they just have a non-threatening issue, but they don't have a doctor and they're in the emergency room for 20 hours.